your mouth. Perfect. Now, I'm going to ask you to open your mouth, and I'm going to place my hand up here, and just open your mouth and kind of resist against my hand. Perfect. Now, can you move your jaw from side to side? Awesome. Now, I'm going to do my hand on each side of your mouth, and then move your jaw side to side again. Okay. Perfect. All right. Now I'm going to touch your face. Let me put these on here, sanitary purposes. And then I'm just going to do that to assess kind of if there's any weakness or if it doesn't feel like something is standing right, okay?
Okay.
Here. Awesome. All right. Now, can you clench your teeth for me? Perfect. All right. Now I want you to close your eyes. I'm going to use this. I'm going to touch your face and just tell me where I'm touching, okay?
Okay. Forehead. My cheek. My chin. Forehead. Cheek. Chin.
Perfect. Okay. Now I want you to sit up and look straight ahead. Perfect. Now I want you to wrinkle your forehead and look towards the ceiling without moving your head. Perfect. Now close your eyes as tightly as possible. Awesome. And can you pucker your lips out? Perfect. Now I want you to smile and pull the corners of your mouth all the way back as far as you can. Awesome. Now can you show me your teeth while frowning? I know this is a tough one. There you go. Awesome. All right. Now with this one, I'm going to put these against your mouth, and I want you to say puff, 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 and we're going to do 3 rounds for 5 seconds each, okay? And I'll count out loud.
Okay. Puff, 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 puff.
Awesome. Okay, so that was 1 round, and now we'll do another one, okay?
Puff, 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 puff,
5.
puff.
Okay. 1, 2, 3, 4, 5. Awesome. Now I want you to do the same thing, but I won't hold these against your mouth, okay?
Okay.
Perfect. That was 1. We'll do 2 more. Awesome. One more time. Good. Perfect. Okay, now I'm going to have you taste 4 different things. I want you to close your eyes and then tell me what your taste. The 4 things are going to be sour, sweet, salty, or bitter. So when I give them to you, just tell me which one is which, okay?
Okay.
And these ones I'm placing on the front of your tongue.
Okay. Sour.
Okay.
Sweet. Salty. Bitter.
Perfect. All right, now I'm going to do the same thing. Give you 4 more things to taste. Only this time I'm going to put them on the back of your tongue.
Okay.
Once again, salty, sour, sweet, bitter.
Sour. Sweet. Salty. Bitter.
Perfect. Okay. Now can you just open your mouth for me? And now say ah.
Ah.
Awesome. Okay. I just want you to blow this in front of me. Perfect. And now can you say ah again for as long as possible?
Ah.
Good job. Okay. Now I'm going to ask you to turn your head and then keep your head turned and push against my hand, okay? Perfect. Okay, now I'm going to do the other side. Perfect. Now push your head forward against my hands as I try to push them back. So I'm going to place them here. Push forward as I push back. Good. Okay. Now just shrug your shoulders for me. Awesome. Okay. Now open your mouth for me. Just going to take a little look. Okay, Good. Stick out your tongue. Awesome. Now open your mouth again. And then I'm gonna, so close it one more time and then open. There you go. Perfect. Now can you move your tongue from side to side? Awesome. Now I want you to push your tongue back against this tongue depressor. Good. Now we're going to do the same thing while you move your tongue side to side. Good. Okay. And that's it. Awesome. You did awesome. Thank you so much for your time and participating.
Thank you.
Alopecia. Her scalp is intact. I observe for bumps, lumps, and any bruises. There's nothing. While I'm here, observing behind the ears, looking into the actual ear, but not into the ear canal itself. You want to assess both sides. No signs of excess drainage or anything inside the ear. Then I look at my patient's face and I observe for the same lumps, bumps, bruises. I assess skin color, make sure that the blood is flowing evenly throughout the tissue. While I'm here, ma'am, could you please remove your glasses for me? I'm going to assess your eyes, assessing the cranial nerves 2, 3, and 5. 5, I believe. So first, we assess the pupils. I'm going to shine this light in your eyes, okay? The pupil constricts, and we assess the other side. Both pupils constrict. When light is shined into one eye, the other constricts, and the same vice versa. I'm also going to assess eye movement. So you're going to focus on my pen right here, and with your eyes and only your eyes, you're going to follow the pen going into the 6 cardinal positions. We assess for accommodation. Focus on my pen, please. Now please focus on the phone in front of you. Focus on the pen once again. The eyes do constrict. They are round, equal. They both evenly react to light. Accommodation is good. I also assess the sclera, white. If I can pull down your eyelid, conjunctiva is also a pink color, red, pink. While I'm here, I assess the nose. A quick assessment into the nares. There's no drainage. There is no abnormalities, no discharge. The mucous membrane is intact. Could you please cover one nostril, please? Blow out. Switch nostrils, please. Patency is good. I'm going to assess my patient's mouth as well. Could you please puff out your cheeks? Blow out. Stick out your tongue for me, please. Go ah. Wider. Okay. Mucous membrane is intact. My patient has all her teeth, no dentures. There are no openings, no lesions, no bruises. The patient can stick out her tongue straight. Patient, do you have any difficulty eating or drinking? No difficulty eating or drinking. Can I assess your neck? Mm-hmm. We're feeling around here to assess the lymph nodes. Normal lymph nodes usually are not felt or cannot be observed. Is there tenderness anywhere? No tenderness. Assessing my patient's neck as well. Same thing for tenderness. Any bruising, any lacerations. Skin color is normal. Her neck can support the weight of her head properly. Do you feel any discomfort?
No.
Could you please turn your head to the right? That was your left. Then your left, please, ma'am. You look up, look down. Range of motion is good. So, assess the neck, assess the head. While I'm here, I want to try to keep everything systematic and in order. So I'm going to assess your lungs now, posterior and anterior side, so the front and the back. If you could please lean forward, I'm going to listen to your lungs. While I'm assessing, I want to make sure that I go bilaterally, so one side and the other. You want to make sure that you do this evenly. And of course, you want to listen to the top. You progress lower, and you want to make sure that you reach the sides as well. So not forget those. And of course, because the heart is on the left side, the left lung only has 2 lobes as opposed to 3. So breathe in for me. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Okay. So that's basically how I would listen to on the back. I go towards the front and I would do the same thing, of course. Checking bilaterally. So once again, take a deep breath. Breathe out. Deep breath. Breathe out. Deep breath. Breathe out. Same thing. And once I finish listening to all the spots where I would assess the lungs, I would also then move on to the heart. I could now assess the respirations while my patient is unaware, or I could also wait to do this while I assess for the pulse, and then afterwards listen without my patient knowing. This helps prevent her from altering her breathing. Patient is not having difficulty breathing, no labored breathing, there is no use of accessory muscles, her breathing is fine with no adventitious sounds. From there, I would move on to the heart. So, same thing, I would use the diaphragm of my stethoscope. And with this, you would want to listen underneath the t-shirt. This is my wife, so I'm comfortable doing this, but you would ask your patients. So, assess for the heart sounds. You want to make sure that you listen for any abnormal sounds, any arrhythmias, any swooshing sounds that may be signs of blockages in the arteries. So once I finish assessing the heart, I also want to move on to the extremities while they are here before going to the abdomen. While I'm here assessing the extremities, I can also check for capillary refill. I can check the pulses just to make sure that perfusion is good and the blood flow is flowing appropriately. So assessing the arms, you can see that the arm color is appropriate for ethnicity. Temperature is warm. I take the fingers and I squeeze for a few seconds, releasing. And the color returned immediately, under 3 seconds, so this would indicate good capillary refill. You would do what you would the one side to the other. So you would want to make sure that you assess everything bilaterally, and this would indicate any abnormalities. There is no edema present. Could you squeeze both of my hands with, or my fingers with yours? Grip strength is even on both sides. Push down on my hands. Okay, now push up. Hand strength is even. Could you raise your arms up? Lower them. Extend them to the side. Range of motion is good as well. I would assess my radial pulse here with my 2 fingers, not using the thumb because my thumb has its own pulse. I would assess for 30 seconds. If everything is normal, then I would multiply that by 2. But if I feel that there are any abnormalities, I would listen for the full minute, preferably listening in the chest to the heart directly. And then I would also go to the brachial pulse to assess this one right here with my 2 fingers. Assess the other side. There's the popliteal behind the knee. Could you lift your leg, please? Right here at the ankle, in between the bone and the what is it? The dorsalis pedis. Okay. So that's my pulses. Moving on from the arms, I would go to the abdomen. So if you could lay back just a tiny bit, please. Lay back. First, I take my stethoscope and I would start at the bottom right quadrant, working my way up and over. I place my stethoscope here and I listen. If I can hear the bowels within under 10 seconds, then there's no need to listen for the full minute. I can move on to the next section. But if there's an absence of bowel sounds, then I'll take my stethoscope and I'll listen for 5 to 10 minutes in each quadrant. So first I inspect, there are no protrusions, there's no bumps, lesions, or anything. I listen with my stethoscope, I hear the bowel sounds, I move over, I hear the bowel sounds, I hear the bowel sounds. So then I can start to palpate with my fingers. And here
I'm going to shine my pen light into her left eye and check for constriction in the left eye. I'm going to shine it again and check for constriction in the right eye. I'm going to now shine my light into the right eye and check for constriction. I'm going to shine my light again and check for constriction in the left eye. I'm going to turn my light back on. I'm going to have her look at my pen light and then look into the distance. I'm going to have her look at my pen light and look into the distance. Her eyes should constrict when she looks at the pen light, and they should dilate when she looks away towards the wall. I'm going to look into, I'm first going to make sure that she doesn't have any assistive devices such as glasses, prosthetic eyes, contacts. I'm going to look at her ears. And I'm going to check for any drainage, assistive device such as hearing aids. I'm going to check this ear. Okay. I'm also going to now do my cardinal field gaze. I'm going to have her look at my pen light and then follow it without moving her head. I'm going to go up, down, across this way, up, down, and up. Okay. I'm now going to do my whisper test. I'm going to have you cover your right ear. I'm going to whisper in your ear. And can you repeat it back to me?
ABC.
Okay. I'm going to come around. I'm going to have you cover your left ear. And can you-
ABC.
Okay. Okay. Now I'm going to check her nose for symmetry, make sure it's midline. I'm going to check the nose for, make sure the mucous membranes are pink and moist. I'm going to have her cover one nostril and breathe in and out, check for patency. I'm going to have her cover the other nostril, check for patency. Okay. Now I'm going to check her mouth. I'm going to have her smile for me. Okay, smile symmetrical. She doesn't have any facial drooping. I'm going to check her teeth. Her teeth are not missing. She doesn't have any missing teeth, broken teeth, any dentures. I'm going to check and make sure uvula is midline. Okay, uvula and tongue are midline. She doesn't have any sores in the mouth. Mucous membranes look pink and moist. I am now going to check her trachea, which looks midline. I'm going to have you turn your head to the right for me. I'm checking for jugular vein distension. Okay, and I'm going to have you turn your head to the left, checking for jugular vein distension. Okay, now I'm going to assess for carotid bruits with the bell of my stethoscope. I'm going to check this side. And I'm going to check the other side. Okay. I'm going to then check, I'm going to check for shoulder shrugs. I'm going to put resistance on your shoulders and you're going to shrug them up. Okay. I'm going to check the scapula for any open areas, any sores. I'm going to check her arms for any IVs, drains. I'm going to check her overall for any ostomies, Foleys. I am going to have her grip both of my hands. I'm going to check bilateral grips. I'm going to check capillary refill, both hands. That should come back in less than 2 seconds. I'm going to check her blood pressure using the two-step method. Normal blood pressure is systolic 90 to 119 and diastolic 60 to 79. I'm going to check her radial pulses bilaterally. I'm checking for rate, rhythm, and quality. I'm going to grade it on a scale from 0 to 3, 0 being absent, 1 being normal, 2 being 1 being weak, 2 being normal, and 3 being bounding. I'm then going to assess skin turgor on the back of the hand, make sure there's no tenting. If she was older, I would check at the clavicle. Now I'm going to assess heart sounds. I'm going to use the diaphragm and bell of my stethoscope. I'm going to assess on the second intercostal space on the right sternal border. I'm going to check the aortic with my diaphragm and bell. I'm going to check the left sternal border, second intercostal space for the pulmonic valve, and I would not be doing this over clothing. I'm going to go down 1 intercostal space at Erb's point, bell and diaphragm. Going to go down 1 more intercostal space, tricuspid valve, bell and diaphragm. Then I'm going to go across to my mitral valve, bell and diaphragm. And I'm going to check her apical pulse for 1 full minute. Apical pulse should be between 60 and 100 beats per minute. I'm going to also check for overall chest rise and fall, making sure that it's equal and symmetrical. I'm going to check respirations at this point. Respirations will be between 12 and 20. I would make sure that she's not using any accessory muscles, which right now she isn't. I'm also going to right now check respiratory sounds. I'm going to use the diaphragm, and I'm going to start on the right side. And then I'm going to move across. And then I'm going to come down and then move across. And then come down and then move across. And then I'm going to 7 and then 8. Okay, now I'm going to have you sit up for me on the side of the bed. And I'm going to check posterior lung sounds. I'm checking for any crackles, wheezing, bronchi, rales. I'm going to start 2 inches down from her shoulders. I'm going to start on the right side of the spine. And then I'm going to move across. Then I'm going to come down. Then I'm going to move across. I'm going to come down and move across. I'm going to come on the side and then across. All of this will be done under clothes. I'm going to come around to the side. I'm going to have her put both her arms out for me, palms up, and close her eyes. And then for 30 seconds, I'm going to assess for pronator drift, making sure that they don't drift anywhere, which could be a sign of a neurological deficit. Okay, I'm going to have you stand up for me now, and I'm going to have you walk for me, and then walk back. I'm assessing her gait. If it's steady balance, I'm assessing for any assistive devices such as canes, walkers, crutches. You can lay back down for me. Okay, now I'm going to assess her abdomen. When was your last meal?
About an hour ago.
And do you have any dietary restrictions?
No, ma'am.
And when was your last bowel movement?
This morning.
Okay. I'm gonna look at her abdomen, checking if it's round or distended. I am then going to listen, starting at the right lower quadrant with my diaphragm. I'm gonna assess bowel sounds, and then I'm gonna move up to right upper quadrant, left upper quadrant, and then come down to the left lower quadrant. I'm assessing if the bowel sounds are between 5 and 30. Now I'm going to also assess the abdominal aorta. I'm going to go 2 inches with my bell of my stethoscope. I'm going to go 2 inches above the umbilicus. Then I'm going to come down 1 inch. And then I'm going to do 1 inch below the umbilicus. Okay. I'm also checking for any ostomies in this area or drains. I'm going to ask her, are you having any burning or pain, frequency, urgency with urination?
No, ma'am.
Okay, are you having any odors or abnormal discharge?
No, ma'am.
And her bladder does not seem distended. She does not have any Foley's, no catheters in that area. I'm also going to perform range of motion. I'm going to move her arms up and out. And then I'm going to move her arms up and out. I'm also assessing her elbows, her sacrum at this point, her heels.